What to do with a pregnant woman to make her unborn child healthy? Good day everyone and have a nice day. So I am going to talk about what to do with a pregnant woman to make her unborn child healthy. A pregnant woman who cares for herself also cares for her unborn child. According to kidshealth.org, key to protecting the health of your child is to get regular prenatal care. Please first visit your healthcare provider where probably do a pregnancy test and figure out how many weeks pregnant you are based on a physical examination and the due date of your last period. Throughout your pregnancy, your healthcare provider will check your weight and blood pressure while also checking the growth and development of your baby. By doing this, like feeling the abdomen, listening for the fetal heartbeat starting during the second trimester, and measuring your belly. During the span of your pregnancy, you also have a prenatal test, including blood, urine, and cervical test, and probably at least one ultrasound. A pregnant woman needs to avoid vice in order for her unborn child to be healthy. According to kidshealth.org, when you are pregnant, what you don't put in your body or expose your body to is almost as important as what you do. Here are some things to avoid. Alcohol, one of the most common known causes of mental and physical birth defects. Alcohol can cause severe abnormalities in developing fetus. Alcohol is easily passed along to the baby, who is less equipped to eliminate alcohol than the mother. That means an unborn baby tends to develop a high concentration of alcohols, which stays in the baby's system. For alcohol, which stays in the baby system for longer periods than it would at babies mature, and the alcohol intake as well as periodic binge drinking as damage a baby developing nervous system. Recreational drugs. Pregnant women who use drugs may be placing their unborn babies at risk for premature birth, poor growth, birth defects, and behavior and learning problems. And their babies could also be born addicted to those drugs themselves. If you are pregnant and using drugs, a health clinic such as Planned Parenthood and recommended healthcare providers at little or no cost who can help you to quit your habit and have a healthier pregnancy. If you are use any drugs at any time during your pregnancy, it's important to inform your healthcare providers. Even you are quit, your unborn child could still be at risk for health problems. Nicotine. Pregnant women who smoke pass to nicotine and carbon monoxide to their growing babies. The risk of this include prematurity, low birth weight, sudden infant death syndrome or SIDS, and other respiratory problems in the child. If you smoke, having a baby might be the motivation you to need to quit. Talk to your healthcare provider and about option for kicking the habit. Food smarts and other precautions. Although you need to eat plenty of healthy foods during pregnancy, you need to avoid foodborne illnesses such as enterosis and toxoplasmosis, which can be life-threatening to an unborn baby and may cause birth defects or miscarriage. According to my auntie, when she gave birth to her first child, she was and smoking. Then she gave birth, her child have prematurity, low birth weight, and respiratory problems. So she regretted what he had done because the one who suffered for what he did then was his son. And then my auntie had a hard time with what he did because she said she was having a hard time with her Joe giving birth. And she was about to die because of her abuse when she was still pregnant. Although, in order for unborn child to be healthy, a woman needs good nutrition to support the needs of her child. According to kidshealth.org, nutrition and supplements, healthy eating is always important, but especially when you are pregnant, so make sure your calories came from nutritious food that will contribute to your baby's growth and development. Try to maintain a well-balanced diet that incorporates the dietary guidelines including lean meats, fruits, vegetables, whole grain breads, low-fat products. By eating a healthy, balanced diet, you are more likely to get nutrition you need. But you will need more of the essential nutrients, especially calcium, iron, and folic acid than before you become a pregnant. Your healthcare provider will prescribe prenatal vitamins to be sure both of you and your growing baby are getting enough. Fluids. It's important to drink plenty of fluids, especially water, during pregnancy. A woman's blood volume increases dramatically during pregnancy, and drinking enough of water each day can help you to prevent common problems such as dehydration and constipation. Exercising during pregnancy has been shown to be very beneficial. Regular exercise can help prevent excess weight gain, reduce pregnancy-related problems like back pain, swelling, and constipation, improve sleep, increase energy, boost your mood, prepare your body for labor, lessen recovery time after the birth. Low impact of moderate intensity exercise and activity such as walking and swimming are great choices. You also can try yoga or pilate classes, videos or exercise apps that are tailored for pregnancy. These are low impact and they work on strength, flexibility, relaxation. But you should limit high impact aerobics and avoid sports and activities that for a risk or falling or abdominal injury. These include contact sports, downhill skiing, scuba diving, and horseback riding. Whatever type of exercise you choose, make sure to take lots of breaks and drink plenty of fluid. Slow down or stop if you get short of breath or feel uncomfortable. If you have any question about doing a sport or activity during your pregnancy, talk to your healthcare provider. It's important to get enough sleep during your pregnancy. You'll probably feel more tired than usual. And as your baby gets bigger, it will be harder to find a comfortable position when you are trying to sleep. According to my beautiful mother, she said when she was still pregnant, she liked to eat fruits, vegetables, and she also liked to exercise like walking. So, I thank my mom because when I was to her womb, she took good care of me. The pregnant woman who loves her womb also loves her family.